I was in Afghanistan between 10 and 20 of June to document the projects in Lashkargah. The hospital provides free healthcare for the population. There were a lot of patients coming every day, a lot of emergencies as well. One day I came in the hospital and that was just after the bomb attack, and the hospital received around 20 heavily wounded patients. That is something which can happen every day, so people are very tense and very nervous. They're not sure what's going to happen.
My name is Martin. I am a surgeon working for MSF. In Boost Hospital, we have an operating theater complex composed of 2 operating rooms and 1 recovery room. I am directly supervising 14 local surgeons. There are 5 senior surgeons, 9 junior surgeons. They're basically general practitioners with surgical skills. But these 5 surgeons have been operating for over 20 to 30 years already. And in this picture, you clearly see local surgeons assisting Dr. Marcial. A big part of our mission here is not just to supervise, but also to teach surgeons, firsthand. When I'm operating, there's usually a plan in my mind already. There are established protocols on how to do a procedure, how to cut, what to clamp, what not to clamp. But generally, what's going through my mind is just to do the procedure as quickly and as safely as possible.
I am Laura Mendicoa, pediatrician in Boost Hospital in the pediatric service. I arrived to the hospital and the first thing I have to do a very fast medical round, and check if we have serious conditions. When a patient is more serious, I remember, of course, what the patients suffer, because my main task in this hospital is trying to improve and trying to avoid the high mortality as much as possible. We calculate the solutions, please. Yes. Here. Okay. How many kilos?
28.
2.8.
2.8.
People will only go to the hospital when somebody's really, really sick, and often it's already too late. And it's not a modern hospital where all the equipment is present. So with the means the teams have, they try to keep these children alive. Sometimes children die. You can see there's a lot of medical staff present, but it was very hectic. People walking around, new patients were brought in. As a doctor, you have to make a choice who is worse affected and treat them first. In Afghanistan, there are around 10 million landmines, often found by children. They don't know what a landmine is, and they start playing with it as a toy. These kids took the landmine home, and the parents were not home. They threw the landmine on the cooking fire, and the landmine exploded. These 2 kids were treated every day. They got new dressing. There was the first day when I arrived in the hospital when they were brought in, and the day I left after 10 days, they were already much better.
My name is Fatima. I'm in Helmand, and I'm working as a midwife assistant. Sometimes we have a lot of mothers. They're coming. They are not in a good condition. Sometimes we are losing the baby. When we have a mother and the mother has a healthy baby and they're happy, it's making us very happy. Okay. Because in that time we are thinking we did some things to the peoples.